Hi everyone, it's Emma here, and today I'm answering the question, how do you check if I have IBS? So this is a really common question that we get through our AvoGo helpline. So this is why I wanted to answer it today in as full a way as I can. So first of all, as nutritionists, we can't legally diagnose, and then especially over the internet, we need a full medical history and things like that, and to liaise with the doctor. So that's why to make a formal diagnosis, you would need to actually go to your doctor for that part, and then beyond that, once we know what's happening, we could potentially stand in and help. So that's the first thing, that it wouldn't actually be us here at AvoGo to make that diagnosis, but of course you can go to your doctor for them to help do that. So how is IBS diagnosed with your doctor? So first of all, when it comes to IBS, what your doctor would be able to do would be to rule out other potentially more serious digestive conditions. So that's options like your IBD, and that includes your Crohn's disease, your ulcerative colitis, for example. Then they might also rule out things like celiacs, which would need to be quite carefully managed and can be quite serious. So your doctor would aim to rule out all these potentially more serious digestive conditions, and then they would perhaps introduce something like the Rome criteria, and that's looking a bit more into the symptoms, how the symptoms present themselves, and then they would potentially make an IBS diagnosis. But the problem with an IBS diagnosis then as well, so you might think, I've been diagnosed, that's great, but actually IBS is such a general term, it's an umbrella term, and the symptoms themselves can be really quite varied within that large IBS kind of umbrella term or diagnosis. So even when we get a diagnosis of IBS, sometimes you'll read online that there's no cure, it could be lifelong. But really what we're meaning here, there's no universal cure. And this is where it's really important that IBS needs to be managed on an individual basis, because those symptoms can be so wide and so varied. So that's just something that I like to reiterate, and I do like to go back to that there's no universal cure, but absolutely there are ways that you can help manage the symptoms through diet, lifestyle, supplements and things. So now I'm going to move into what you should do. So this is perhaps if you've had an IBS diagnosis, or if you're going through that process, the diagnosis process. Of course, there are some things you could try yourself at home to help yourself until you potentially reach that final diagnosis. So first on my list is to calm an initial flare-up. So quite often people get in touch with us when they are struggling with their symptoms, and sometimes, understandably, people would like something to quite quickly calm symptoms. And in terms of medications and things, sometimes the medications can help with that initial flare-up as well, but longer term, we really want to try and get to the root of the problem underlying. But of course, something initially is often useful. So this is where we would often recommend something like silicone gel. So it is licensed for the relief of IBS type symptoms, including your flatulence, your discomfort, diarrhea type symptoms. So it is often very good for promoting some calm initially and helping to calm those symptoms. So I quite often recommend a course of that for a couple of weeks. It can be taken longer term if you want, but I personally like to see the silicone as a bit of an initial first step to calm those symptoms, and then we can take it from there. So second on my list in terms of what you should do is to really consider your symptoms. So as I say, this is completely individual. Of course, there will be some overlap in many of the symptoms, but I really want you to consider as an individual what your main symptoms are. So that could be kind of upper digestive symptoms, your acid reflux, indigestion, heartburn, or there could be constipation dominant symptoms, diarrhea dominant symptoms, or there could be a bit of a mix, kind of that alternating bouts of constipation and diarrhea. When there is that alternating bout of constipation and diarrhea, quite often the constipation is at the root of the cause. So that would be an area to focus on, a really good focus in terms of your diet, lifestyle and supplements to help target the constipation. Then underlying causes as well can include stress. Stress and IBS are very closely related. We will go on to talk a bit more about that. Again, that's quite individual, but that might be an area for you to target as an individual, which could make a big difference. Then there's lots of other factors that, again, you can consider as an individual, so such as antibiotic use. So historic or current antibiotics, as much as they are needed in some cases, they will affect your balance of good bacteria in your gut. And this then can go on to create symptoms relating to IBS in some cases. So that's just really, as you as an individual, to consider your symptoms and potential causes, which will help to tailor how you go on to treat the symptoms. Number 3, we have introducing water. So regardless of your symptoms, whether they're constipation or diarrhea dominant, water for me is always a must. So for people who suffer more from diarrhea, they might worry that drinking more water could mean that they're going to the toilet more often. This is absolutely not the case. Your large intestine is very good for absorbing water back into your system. If you are having diarrhea constantly or frequently, stress can be a factor, but quite often it suggests that something in your gut is irritating your gut, and your body flushing water through to make your stools looser is your body's way to try and get rid of what's irritating the gut. And in this case, we would need to replenish water, absolutely. And by introducing more water, you wouldn't be making that situation any worse. So water is an absolute must for supporting your digestion. And especially in the diarrhea states, it can be really helpful for trying to promote some of that movement, but as I said, it's useful in any state. What I would say is just to try and separate your water from your meals a little bit, because we want to retain those lovely strong gastric juices, so gastric secretions in your stomach. We want that pH to be nice and low so you can really break down and absorb all your nutrients. And this is leading me into my 4th point, to introduce some bitter herbs. So in many cases, some digestive insufficiency can be underlying in cases of IBS. So this is quite often too little stomach acid. It's a really common scenario and could potentially be made worse if we're on long-term digestive medications, for example. So by introducing bitter herbs in your diet, so lots of your lovely leafy greens, especially at the start of meals, this can be a lovely way to gently stimulate your gastric juices. If you struggle to get the bitterness into your diet, then that's where something like a herbal bitters tincture drops will come in, such as your yarrow. These are lovely and bitter, and you can just pop in a small splash of water just 5 to 10 minutes before your meals, and that just helps to get a lovely source of that bitterness in your mouth, which is the first step of your digestion. My 5th point here, I've touched on it briefly, but is to relax as well. So that stress response as well. So quite often, stress can be underlying in situations of IBS. There's a very apparent gut-brain axis, and that's where the stress element comes into it. It can be quite a direct effect. So in acute instances of stress, which are quite normal if they're short-lived, if you have some public speaking or a big event in work or a big family event, you might notice that stress affects your digestion during that time. But we also have instances of chronic stress as well, where the stress is ongoing, meaning that it's going to potentially deplete stomach acid levels, turn off your digestive functions to some degree, and low stomach acid can then cause issues further along the digestive tract in terms of affecting the balance of bacteria and things like that. So stress is an important consideration, and I always say it's very individual in terms of the source of the stress, how much control over it you have. but quite often introducing some stress management techniques or herbs to help with the stress response, such as passiflora, can be a useful step in the bigger picture of managing IBS, along with some of the other tips that we've already mentioned. So I hope that helps with that whole topic in terms of understanding a bit more if you may have IBS and how you would go about it, and from there what steps you might take. So as always, thanks for listening. Please do leave your comments below, ask any questions. I will update with any product mentions in the description, and please do subscribe to our Evolgo YouTube channel and also hit the bell icon so you'll be notified of any future videos. Thanks, take care and speak soon.